Hello, my name is Chelsea Samancic. I'm a physical therapist and I work with Health for Life naturopathic medicine. I'm here today to shed some light on a common condition affecting individuals of all activity levels, plantar fasciitis. So, this video shows a glimpse into what an evaluation and the treatment process might look like for someone entering the clinic with complaints of said plantar fasciitis or heel pain. But what is it? The plantar fascia is a thick band of connective tissue. Now, it originates from the plantar aspect of your calcaneus, which is your heel, and it inserts distally at the metatarsophalangeal joint, which are your toes. The structure itself plays a critical role in stabilizing the arch of your foot during walking and any weight bearing activities. Now, the name suggests this is an inflammatory or acute condition, but in this case, it's not. It's most often seen as a degenerative process as a result of mechanical overload that can induce microscopic tears. So we see this most commonly along the medial aspect of your heel. Now, there are some common variables among individuals with this diagnosis. For one, there's a peak age where it's reported between 45 to 64 years old. Some other risk factors include limited ankle range of motion, elevated body mass index, so that's your BMI, particularly those with a BMI higher than 30. They have just about a 5.6 increased risk compared to those with a BMI of 25 or less. Other things are occupational hazards. So when we get your story and you're sharing your daily activities and your daily demand, we're considering these things to better differentiate what condition you might be walking in with. So, those that work on their feet most of the day, they have about a 3.6 times increased risk of developing plantar fasciitis. Other things we consider would be foot type, so high arch versus low arch, muscular tightness, leg length discrepancies, running activities, and then strength itself within the small foot intrinsic muscles. When we look at a physical therapy evaluation and examination, really the diagnosis of it is clinical. It's based on history and it's based on your physical exam. So we look at common patterns, which are heel pain, which is severe first step in the morning, or sometimes after periods of rest. Pain often will decrease with initial walking, but then you'll find that you kind of fatigue out and pain might return after prolonged time on your feet. The exam includes a variety of factors. We look at identifying specific location of pain provocation. We'd be looking at what your ankle range of motion is that's available to you, both actively and passively, while also looking at muscle length. Other things would be looking at foot posture and biomechanical loading for different positions and movements. And then deciding whether physical therapy is a good option for you. So there's a variety of treatment options that are available. Stretching represents a foundational intervention for individuals with true plantar fasciitis. Be it that range of motion is a high indicator for these patients. We want to ensure that you're returning to function and maintaining as close to normal range in your ankle. And then, as mentioned before, stretching the actual muscles around the ankle, particularly gastrocnemius and soleus, which make up your calf muscle, we'd want to ensure that you have proper length and function there. And as you know, physical therapy, we always endorse strengthening. So we'd be looking at, all right, well, where are you strong? Where do you need support? And so performing specific strength exercises at the foot and ankle, but also looking above, looking at your hip and pelvis stability, looking at core, looking at knee. Is there any area of weakness that might be contributing to why you're here today and why you're having this imbalance? Now, other things would include manual therapy techniques. And so with that, we could do myofascial trigger point release. We can do soft tissue mobilization and stretching. We can use instrument assisted soft tissue work. And also getting deeper into some joint mobilizations, which are an area that patients can't quite do on their own. They really need that hands-on assistance. So, we could do subtalar joint mobilizations or look at where in the foot you need that facilitation. Now, those are pretty standard routes for treatment. There are other options out there. So, for some in the short term, they may benefit from some taping techniques, not to create a dependence from this, but as an initial pain modulator, we can assist with certain taping methods to get things better stabilized for them initially. Patient education is huge. We spend a lot of time educating on anatomy, pathophysiology as to what's going on within the body and looking at ways to modify symptom exacerbation. So, this might be through footwear optimization. So, finding the shoe that might fit you best and providing recommendations for that, giving you home exercise techniques and options to do work independently, and also looking at potentially some adjunctive interventions. What is that might mean for you? You benefit from a foot orthosis, so supporting you with a referral to the proper place to acquire that, or night splints. Those are also in the early stages of diagnosis, can be very beneficial for patients to get through that initial acute phase of healing. Now, what's the prognosis? So, plantar fasciitis is self limiting often. It persists for months up to years, even. So, research does show that approximately 80% of patients will still have symptoms at about 1 year from time of the start of pain. Now, for those that symptoms resolve, average duration is about 2 years. So that's where, again, this is not an acute inflammatory condition. This is chronic, this is degenerative. It needs support and care to help you get through that time of healing with, the best possible um, avenues of treatment and modification in your home and your daily routine. So, physical therapy can provide a comprehensive approach to those that need it. Again, we look at biomechanical factors, tissue extensibility, muscle strength, and education. So, if you find yourself facing similar issues and concerns, you've got heel pain, you're not sure what to do about it, and you need support, give us a call and we'll help you get back on your feet.